There are two different kinds of exercise that have been proven to lower high cholesterol. And if you want to find out which ones they are, then you're in the right place. Hi, I'm Dr. Patricia Mills, holistic medical doctor with a root cause approach to health, and welcome to the Wild Wisdom Show. Today, we're going to be talking about the best exercises to lower high cholesterol that have been backed by science. Now, this is super important because high cholesterol can double the risk of heart attacks and strokes, which is pretty terrible thing to experience. And what the research shows is that specific types of exercises can enhance the ability of our muscles to use fats from our blood, thus improving our blood fats and blood cholesterol levels. But there are specific types of exercise, specific intensity and duration that have to be used in order to get these beneficial effects. So let's start talking about the exercise type. Now, the research shows that the most effective exercises are aerobic exercise, strength training, and then a combination of both. And actually, what you'll understand is that when you combine aerobic exercise and strength training is when you get the best effect. So this is very, very important because if you're looking to have a significant reduction in your cholesterol, jogging may not be enough. You may need to add in strength training because that's when you get a lot of those muscular effects that really gobble up those fats and reduce that blood cholesterol. What's interesting is that there has been research done on the type of exercise called high intensity interval training. And while the results appear to be promising, there hasn't been enough research done yet to say whether or not that this type of exercise is more or equally effective to that combination of aerobic exercise and strength training. But it probably will be effective because when they do look at intensity of that aerobic and strength training exercise, the moderate to low intensity exercise is not as effective as the high intensity exercise. And I'm going to talk about what does it mean for you to be working out at a high intensity aerobic and strength training level. Well, when it comes to aerobic exercise, and by aerobic, it's the typical cardiovascular exercise that you would think of when you think about jogging or swimming or hiking or even running, biking, those types of things. They're considered to be more of those cardiovascular exercises. When you're looking at the intensity necessary to get those effects on your cholesterol levels, we can use different measures. One measure is using a VO2 max or a heart rate max. So if you know what your maximum heart rate is for your age, for example, or you've done a test to determine that, then you're looking at about 80% of your heart rate max or VO2 max. Now that can be tough for some people to understand what that might look like. So there's another scale that I find super useful called the self-perceived exertion scale. It's a scale of 0 to 10, and 0 is you're not exerting yourself at all. 10 is you're doing maximum exertion, like as hard as you can possibly push yourself. And high intensity exercise is rated as an 8 to 9 out of 10 on that scale. For example, if you are running or jogging or cycling or doing any kind of cardiovascular exercise, you have to find yourself breathing very heavily, finding it very difficult to talk. You would not be able to complete a sentence if you were jogging beside someone, for example, and you would be pushing close to your maximum effort. So walking, unfortunately, is not an exercise that will help reduce your cholesterol. It is a very beneficial activity, and it's really, really good for whole body health. But when it comes to cholesterol specifically, you need to be engaging in those exercises that really get your heart rate up, get your heart pumping, get your muscles moving, get the blood flowing, and that's going to be giving you some results. When it comes to strength training, what that means is 80 to 90% of one repetition maximum. Let's say you can do a squat, and the one squat that you can do at the maximum weight for that one squat, let's say, for example, it's 100 pounds, then your repetition maximum is 100 pounds, and then 80% of that would be 80 pounds. And you would try to repeat that 12 to 15 times over the course of your exercise session for that muscle group. So that's what exercising at high intensity strength training looks like. Now, the duration also matters because if you only only do this once a week, you're not going to really see benefits. The research was done on 3 to 5 sessions a week, depending on the study that you look at. And what they found was that you need at least 120 minutes a week of this kind of exercise, ideally the combination of both, to see the maximum results. For example, if you're working out 3 times a week, those workout sessions should be at least 40 minutes each, and that's a good thing to aim for. Now, the interesting thing is that the duration also matters. You might think, oh, it's going to take a long time for my cholesterol to improve. Well, actually, the shortest research study was 6 weeks, and they already started seeing benefits at that 6-week mark. Now, the longer that you do it, the more effects you're going to get. The longest study that I saw was 24 weeks. And yes, they did get really great benefits at that point in time, so long as it was the high intensity training. You could do just aerobic exercise or just strength training, and you will see improvements as long as you stay within that moderate, preferably high intensity exercise range. And when you combine the two, that's when you start to get really amazing effects. Now, exercise is one important piece of the puzzle for high cholesterol, but it's not the only piece. You do need to look at your nutrition. And interestingly, cholesterol-rich foods are not the cause of high cholesterol. And there's other things that could be bumping up your cholesterol that once you identify and you treat in a reverse will actually make your cholesterol drop down very easily. So I recommend that you check out the caption below the video. If you're on YouTube, you look below the video. If you're looking at the podcast, you want to look at the captions there for the links. And what you're going to see is a link to my high cholesterol playlist on YouTube. And there I'm putting all of the videos to do with high cholesterol that I've made, including the 2 surprising sources of cholesterol and what you need to do to reverse it, the nutrition strategies, supplements, toxins that could be causing high cholesterol and how to know if you have this problem, and more. So be sure to check out that super important resource. If you enjoyed this show today, please subscribe, save this episode for future reference, and share. Sharing is caring, and you never know when someone might benefit from this wild wisdom. Thank you for your participation today, and I look forward to seeing you next time. Put your comments down below, especially on YouTube. That's where I tend to see those comments and answer them best. And I look forward to seeing you at the next show. Have a wonderful rest of your evening, day, or night, depending on when you catch this. Goodbye.